Well, hello. This is Dr. Isabelle Amigues, and welcome to the UnabridgedMD Podcast. Here we explore inspiring stories, practical tools, and expert insights for living a healthy life. Whether you're a patient, a healthcare professional, or simply curious about healing, you are in the right place. And as always, if you are looking for something that's so much bigger than just a rheumatology practice, please come check UnabridgedMD, as we are the right place to get you to remission with the least amount of medication. With that said, let's dive in. Well, hello, and thank you so very much for tuning in into another episode of UnabridgedMD. And today's episode is very special for me because, as the name of the podcast and as the name of the practice says, it's hope driven by science. It's making sure that we bring you hope, but that's driven by science because there is data behind all of the things that we're doing. So, Holly, you are one of our DRS patients, and your story is one of hope. And so you have really generously agreed to share the story, your story, basically. And I know when you came, and as you were saying a little bit earlier, as you came, you said, before I found UnabridgedMD, I was really in a, almost dark place, right? Where I felt I had no hope. Do you want to tell us a little bit your story?
Can you hear me okay? Because I think our connection is a little bad.
I do. I hear. I do. Okay. Yeah. No, really well, actually.
You hear me? Okay. My story began about 10 to 12 years ago. I just started getting some weird symptoms here and there. Started with some eye pain, started with joints and muscle pain, stuff like that. Just things that I couldn't put two and two together. Because, I was young, a lot younger at the time. But I do remember specifically, like, my feet would hurt in the morning. I'd wake up first thing in the morning, I'd be refreshed, ready to go to work, ready to hop out of bed, and my feet would hurt. It was just the strangest thing. And as the years went on, I started getting more and more rashes, like a rash on my hand, a rash on my foot, down my arms, across one whole side of my face. And then every time I would go out in the sun, I would burn severely, sometimes to where I would blister. And I was like, okay, this isn't right. Like this, nobody else around me is experiencing these things. So that's kind of the way it started. But it was just such random symptoms that I never put two and two together. And then it was 2017 when I got into a really bad car accident. And that's when everything changed. I started getting more symptoms that were extreme, that were coming on almost daily. And during the accident, I had suffered a traumatic brain injury. And so I had seen many doctors. I had seen eye doctors because it had messed up the alignment of my vision. It fractured 6 vertebrae in my back. So, there was pain everywhere, it seemed like. I dealt with the rehabilitation from the accident for 5.5 years. So just getting passed on from doctor to doctor, some spinal doctors, some brain doctors, some eye doctors. And then I started noticing I was having a hard time swallowing. It was a couple times a week I would choke, and I would choke bad to where it was, 10, 15 minutes to where I'm almost suffocating because I would choke so bad. And it was just getting embarrassing. None of the doctors could really figure it out. And I just got passed around to different people that were like, oh, it's all accident related, it's fine, or it's in your head, or maybe she's over exaggerating, or whatever the case was. So, it took 14 years to find Dr. Amigues, and it was a very, very long journey to the point where she was my last stop. I remember telling my husband, I said, if this person can't help me, then I don't think anyone can. And I'm just going to have to live like this. So I was glad that I found her, and I found her just by random Googling my symptoms because I had ended up turning into Dr. Google myself because it seemed like nobody was able to help me. I Googled a bunch of symptoms, and that's how I found her.
Oh, really? You found me on internet?
Yeah, I just was Googling symptoms and you popped up, and I started reading reviews, and I noticed that you had all 5-star reviews, which I was like, that is so uncommon because in this day and age, there's somebody out there that's got to have something bad to say or bad experience. And every single one of your reviews was 5 stars. So to me, I was like, all right, I got to see this person. I need to get into her.
Yeah. Well, and so I think, it's I'm so honored that you're here and that you're, sharing. What has been different? Like, what is the difference?
Well, the
Because you
very
have
first
seen
time that
other, go ahead. Because you have seen other doctors, so I wasn't the first one for sure.
yeah, I think, I mean, because the week before I met you, I sat down and I wrote down every symptom I had had from big to tiny to figure out maybe this little weird, symptom that I have will lead to something. So I wrote it all down. And I remember bringing you like a page and a half of symptoms. And it went back to the 14 years from the very first symptom. And I remember in our very first appointment, you spent 90 minutes with me. And I think you were the 12th or 13th doctor I had seen. And all the other doctors, you wait in the waiting room for 60 minutes, but you only get to see the doctor for 10, maybe 15 minutes. And it's the usual check your eyes, check your ears, check your mouth, check your heart rate, what's going on? Okay, you get 3 minutes to explain your story, and they basically send you out the door. And with you, I mean, it was 90 minutes, and we went over every symptom and every detail. And I just remember crying and using like almost a whole box of Kleenexes because you were actually listening to me. You didn't cut me off. You validated what I was talking about. And for the first time, I was like, okay, this isn't normal at all, And then you went into an examination. I mean, I think by the time I had left there, it had been almost 2 hours. I remember you giving me that cortisone steroid shot. And I thought nothing of it. I'd never had anything like that before. But I do remember the next day texting your staff and saying, I cannot believe, I feel like a rock star this morning. Like whatever was in that steroid shot made my joints, my hands, my feet, everything. Like I slept better, just something in that last 12 hours of seeing you till the next morning just was so much better. Like I was able to talk to a doctor that actually wanted to listen to me. And you had very insightful ideas on where we could go from here. Hey, it could be this, it could be that. Well, let's check into this. It wasn't just talking to someone that wasn't really listening and ready to get on to their next patient. So, I mean, it was very different, drastically different. I can't tell you how different it was until someone comes and sees you and gets to tell them their story for themselves. And I do remember about a week after seeing you and we were figuring out medications and the next steps and all that stuff. And I remember you called me and I was like, wait a minute, doctors don't call you. I've never once in my life spoken to an actual doctor on the phone. It's always the nurse or the practitioner or somebody that just kind of passes you off, or they email you, and they're like, here's what you need to do. Go get blood work, go to here. We called this in, let us know if you have questions. And a lot of it is just back and forth voicemails. And I remember when you called me, I was just blown away. I was like, this is so strange to me that you actually care. You picked up the phone and you called me and you're like, this is what we're going to do. I called in your prescription, go here. This is the next steps. And then let me know how you feel. I'll never forget. It was all the time that you had spent with me and then just the follow-up and actually picking up the phone and calling me.
And so I want to interject here for auditors here. What you presented with is not atypical at all. And so in a way, I have to say, I'm surprised that no other doctor had picked up on the fact that there was an inflammatory, that even if they don't necessarily know exactly what this is, that definitely there was an inflammatory arthritis going on. And so the shot of steroids that you mentioned, yes, steroids makes everyone feel better, 100%, that's true. But it doesn't put your joint completely at rest if you have just osteoarthritis. It's not like if you have joint pain that's psychologically and so I just feel like if the fact that you felt so much better from all of your symptoms, in addition to the story that you were describing, that together is really a sign that this is something inflammatory. And this is what I tell patients very often. If you have an inflammatory issue, it's very good because that means we can treat it very well. And so, again, I feel like someone else could have picked up on this. So it's not like it's not like I have some superpower, and it's not like I'm making up, new diagnosis. I think it's just in rheumatology, particularly in medicine and in rheumatology particularly, it's more than 70% of our diagnoses are made just listening to our patient and asking them the right questions. And And by not spending enough time with our patients, we are doing a travesty of a work as physician if we're not spending the time to understand what's going on. And yes, we have questions that are very short. It's like, is the pain worse in the morning? Is it associated with morning stiffness? It has swelling. The number of time, it's at the 60-minute timeline that someone said, and I'm like, do you have back pain? And I'm like, actually, well, it's been there forever, so I don't worry about that. And I'm like, wait, hold on. Do you have back pain? Yeah, I've had back pain my whole life. Okay, this is not normal. What type of back pain? And then you learn that it's actually an inflammatory back pain. And then you're like, okay, hold on. Is there a rash as well? It's piecing all of this together that gives us a clue of what this could be. And if there was a test for every single disease that we have in medicine, we wouldn't need doctors. We would just need healthcare, practitioners. So I find that the work for me, the work of diagnosing what's going on, is really one of the things that I love the most, because it helps us. Once we have the correct diagnosis, we can get help, and we can help our patients get to full remission. And that's where we're going with all of our patients. And sometimes for other patients, I've made diagnosis of cancer, I've made diagnosis of infection, but it's not a bad thing. It just means we have treatment, and those treatment are the treatment of the infection, are the treatment of cancer. And there are, I'm thinking of like a couple of patients right now, they're doing perfect. And their arthritis is completely cured, since their cancer is cured, since their infection is cured. And I think that that's something that's particularly powerful, and that's really important. And I want to share this on the podcast because it's so important to realize that one of the reasons we get to remission is that we have the right diagnosis. Is there, like, if you had to talk to yourself a couple of doctors back down the line, like, what would you tell yourself, like, to get to a final answer of what this is, what's going on? Did you not hear my question, Holly? Hello? Can you
No,
hear
I'm
me?
sorry. We're having
No?
a bad connection. There's like a 10-second lag here.
Oh, okay. So I'm going to repeat the question. There's going to be a lot of editing on this one. Normally, it's very easy, so I don't know what's happening. So, Holly, if you had to, like, if at the beginning of the journey, if you were at the beginning of your journey, what would you tell yourself so that you're getting...
At the beginning of the journey, what was the rest of that?
What would you tell yourself if you were able to go as your, as someone that's saying, okay, you're at the beginning of your journey. Here is my recommendation. This is what I recommend you do.
If I had words of encouragement at the very beginning of this, I would have told myself to always believe that what you're feeling and what you're thinking is true. Because I did have doctors tell me that, oh, it's in your head. Or I think that, you're over exaggerating. I mean, I remember reading through some of my medical records, and one doctor did say he believes that it's in my head, and the other guy said that he believed that I was over exaggerating symptoms. And to me, I was like, so not only are you not listening, you're not trying to fix what's going on here, now you're judging me also, which made me feel worse, that like I never wanted to go back to them. And I'm so glad that after all the doctors I saw, that I did stick true to myself, because otherwise I think that I don't know where I would be. I mean, I just remember telling my husband, I said, I just wish somebody would let me try some medication. Just let me try it for 2 weeks or a month or something, just to see if it helps. Because I had gotten so many diagnoses of fibromyalgia. It was like nobody could ever figure it out. And so they kept saying, you have fibromyalgia, let's put you on an antidepressant. And I was like, well, I don't feel depressed. I don't really think I'm depressed, So I was just confused at why would I get on an antidepressant. And they're like, well, it helps with widespread pain from fibromyalgia. And I'm like, well, could this be arthritis? Could this be something else? Because when I Google my symptoms, it kept coming up with lupus or RA and fibromyalgia. But, after being told that numerous times, I was like, I just don't think that this is truly what it is. And I'm glad that I stuck to my guns and truly believed what my gut feeling was. It was like, these symptoms aren't in my head. They are progressively getting worse. My husband, my dad, my friends and family would notice that just, my dad even was like, you're walking differently. He's like, your gait is different. He's like, are you okay? And I'm like, no, my feet hurt a lot. If I sit too long, it hurts. If I stand too long, it hurts. It's like something in my body is just not working right. So other people were noticing, it's like, why can't the doctor just give me a trial of something other than an antidepressant? And I remember the rheumatologist I saw right before I saw you. She was the one who went on and on about lupus. And she's like, I'm pretty sure you have lupus. Let's do this blood work. She explained what hydroxychloroquine was and all this stuff. And then the blood work came back and it was negative for lupus. And her assistant left me a voicemail and just said, you have fibromyalgia. Just keep taking your your antidepressant medication.
Yeah.
And I was like, so I didn't even get to have like a follow-up or talk to her or say, just because blood work didn't show lupus, what else could this be? Like, I just felt like I hit a wall again. It was crazy. And then I waited almost a year before I found you. And that's when I told my husband, I said, this is it. I'll go one more time. And after that, I guess I'm living with it.
Yeah. And then look at you. You're so much better now. So where are you at right now? You're not yet in full remission, but we're on the journey, correct?
Yes,
because that's
I would say,
give us,
yeah, so much better than where I was last August when I saw you. I mean, so almost a year to the day. You gave me medication right away. You gave me a steroid shot. And over the last 12 months, the pain and just the anxiety of whatever this is has gotten so much better because we're figuring it out together. And in the meantime, you gave me medication that helps me get through like day-to-day life. And yeah, I'm not in remission yet, but I do think that these other medications we're talking about, I will get there one day. And it's a heck of a lot better than it was 12 months ago. So I'll take that no matter what. But I always think about you talking about remission and how you want remission for all your patients. And I want that for myself too. I think it's in the near future. We just got to tweak some medications, but I mean, I feel better now than I have in the last 14 years.
Holly, yes, I agree with you. And I think the thing that's important is to realize that sometimes you can be a lot better, but it's not perfect. And I want more than just a lot better, right? Because I feel like in some practices, they would have been like, oh, you're doing better, that's it. And you're like, no, we need.
Well, and just one other thing, I remember, I think it was the second time I had talked to you when I kept telling you how I had constant liver pain and all these other doctors, like I had been to a liver doctor, I had gotten a scope, I had gotten all these things, CT scans, MRIs, and they're like, you're too young to have liver pain. I mean, I remember when I scheduled the appointment for the liver scope and they were like, you're like 39 years old. What are you doing here? And I'm like, I've had liver pain for 5 years. Like it hurts on and off. I don't know what brings it on. I don't know what makes it go away. And I remember when I had told you like one specific thing about it and you're like, I think you have endometriosis. And I was like, huh, I don't even know what that is. But then as we dug deeper, it was like, yes, I do have this. I do have that. My periods have been hell for years, and you sent me to your friend who was an OBGYN. And on the very first appointment, she's like, I think you have endometriosis. And I was like so excited to have an explanation. I was like, why am I barely 40 years old and my liver hurts? And she was like, I think the endometriosis has just grown around your liver. And she's like, that's where the inflammation and the pain is coming from. Because it was following my period. That's why I was like, I don't know what brings it on. I don't know what makes it go away. It's just some days it hurts, some days it doesn't. And as soon as I told you one specific thing, I was like, sometimes when I drink alcohol is when it really acts up. And you were like, I think you have endometriosis. It was just incredible how you put 2 and 2 together. It was like you connected the dots just by listening to me. And you were right. And 5 years of tests and CT scans and endless amounts of money and time and doctors. And you figured it out over a Zoom call and the OBGYN confirmed it.
Yeah. Well, it's so wonderful, Holly, to talk with you, and I think what's really cool and the message I want to share, that I want us to share here is stay true to yourself and believe that we can figure it out. And I think that people are being gaslit in the medical community because doctors have no time, and if they are not doing well themselves, it's really hard for them to offer good care. Uh, all of the things that I found, like as you mentioned, oh yeah, just one little detail that you gave me, and I was like, I'm pretty sure this is endometriosis. I think it was, I asked you, like, does it move with your cycle? And you were like, actually it does. And I was like, I think this is
Yeah.
endometriosis. But it's really interesting. I think that very often in the insurance model, it's really hard for physicians to have that sort of time, and we're not going to be able to go to details. And how we are being taught as physicians is like one problem at a time, when really all of those different problems lead to one unifying diagnosis that we can help. And so I'm so grateful that you're saying this, that you're saying, stay true to yourself, believe in you, what you're experiencing. And even if someone says, you have like a psychiatric issue, like what type of psychiatric issue are you? Like, okay, sure, you're diagnosing me with psychiatric issue. What is it that you're diagnosing me? Because that is actually, then they have to figure it out. Then they're like, okay, let me figure this out. And then the psychiatrists are going to be like, no, actually you have nothing. So go back to your doctor. They need to figure it out. So
Yeah.
to me, it's always like every time I'm hearing that, I'm like, okay, what type? Like, okay, so if you think this is a psychiatric issue, what type? What are you saying it is? And it will pause the physician. I remember teaching resident and fellows, and they would be like, I think this patient is crazy. Okay, what type of crazy? And then turns out it's withdrawal from benzodiazepine, and it's actually, life-threatening. We have to go a little bit deeper than just like labeling patients with like big things that mean nothing. So to me, it's like, I believe in that. I really
Yeah.
truly think that that's what's needed. And we are good. I think our training in medicine is very good. So I think physicians have the ability to make beautiful diagnoses, and so then we can treat. But Holly, thank you so much for your time here. Thank you for sharing this. Thank you for believing in you, and thank you for believing in the practice. It really is an honor with you on this path to remission with you, and we're so close. I'm super excited because like there's nothing better for me than seeing my patients in remission. I'll be honest, right? That's like my life's purpose is to get my patients in remission. So
Yeah.
it's a true honor. It really is. Well, thanks again for tuning into the UnabridgedMD podcast. Be sure to subscribe so you can be notified when the next episode is up. And as always, if you think that this would be helpful for a friend or a family member, please share. Wishing you wellness. Until next time, take care.